Knock, knock. Hi there. My name's Michaela. I'm going to be your nurse today. I heard that it's time to change your dressing on your central venous access device. Is this okay if I go ahead and get started on this?
Yeah.
I'm going to go ahead and close the curtain just so I provide some privacy for you, okay? Closing the curtain. Can you confirm your name and date of birth for me?
Abby Decker, 9/20/09.
Perfect. I'm going to go ahead and put this mask on you.
Okay.
Just with COVID and everything, you know.
Mm-hmm.
And just making sure that when I take off the dressing, you know, you're not getting it, you're not breathing on it, and I'm not breathing on it, okay? Go ahead. Perform some hand hygiene. Okay. And I'm just going to put on some clean gloves so I can take that off for you, okay? Do you have any questions about anything before I get started?
No.
Alrighty. I'm going to ask you to turn your head the other way. Try to have it that way the whole time, okay?
Okay.
Just so you're not breathing on it.
Okay.
And one of the most important things to remember is that when a patient has a central venous access device, whatever way that it was put in, you want to make sure that you're taking the tape off in that direction. You know, if it's put in this way, you don't want to be taking tape off that way. You want to be taking the tape off with it. So let me know if I'm pinching your skin. Sometimes when patients have these, you can use alcohol wipes to help remove the tape. It can make it a little bit less painful for the patient. And it's also can be really helpful if a patient has, you know, really hairy skin, an older male adult. But Abby's pretty young. And she doesn't really have any hairy skin. You doing okay?
Yep.
Almost got it off here for you, okay?
Okay.
Alrighty. So I'm going to go ahead and throw the bandage away. I'm going to go ahead and turn the other way, please. And I'm just assessing the skin for warmth, any discoloration, or any signs of infiltration. But overall, yours looks really good, Abby. Okay?
Okay.
Just keep hanging that way, okay?
Okay.
We're discarding everything in the proper bag. I'm going to perform hand hygiene again. And we're going to go ahead and get started. So this is a sterile technique that we're going to use. Open up the package. And I already have a mask on because COVID and everything. So I don't have to use the mask that was given. Go ahead and take my gloves out. I really need a size bigger gloves, but just making it work. Take out the field. Just grab it right there. I'm going to keep it above my waist. Now, if we were using this at the hospital and they did not have stereo strips that were put in the bag, then I would have had to open them before I put on my gloves. But this kit comes with strips that are already in the bag, and I'm just putting everything on the sterile field. And then my label. All right, Abby, so the first thing I'm gonna do is just use some chlorhexidine to clean your catheter, okay?
Okay.
Make sure it gets all wet, straining. So you wanna make sure that if you start in the middle, you know, you're going out and then not coming back. And we're cleaning everywhere. Can you turn your head for me still?
Mm-hmm.
Sorry, I know it's hard. Cleaning side to side and up and down. And we're taking it and we would really uncoil it and clean the whole cord and make sure everything, but obviously this is not a real catheter. I'm gonna go ahead and discard this in the biohazardous waste bag. And I'm gonna provide the patient with a skin barrier. The skin barrier is gonna help make sure that the skin is not getting infected with anything. And a lot of the times patients complain of pain, you know, with the bandage on it and that it kind of bothers them. So this just kind of prevents that. And you want to make sure that you're going a little bit farther than what the bandage will provide because you'd rather have a little bit too much of the area clean than not enough. So I'm going to go ahead and let that dry for about 30 to 60 seconds because if it's not fully dry, it's going to be really hard for the bandage to stick, okay? I'm going to go ahead and let that air dry. You doing okay? We're hurrying for you here, okay?
Okay.
So it's been about 30 to 60 seconds. So I'm going to remove the backing. And we would have recoiled it back up. And I can use 2 to 3 steri strips if it was having trouble coiling back up. So we'd apply those across, but I'm just going to go ahead and put this on since hers is not having any trouble coiling. Just sticking it on, making sure it's all down. And then we're going to peel these off. It's a patient. You still doing okay?
Yeah.
No pain?
Nope.
No pain, no gain, right?
Yeah.
Sorry, I'm having a little bit of trouble getting this.
It's fine.
Let me try and peel from up here over here. There we go. Sometimes they don't want to come off. Not pinching your skin, right?
You are.
Sorry.
It's fine.
Almost got it. Perfect. So I would go ahead and make sure that everything's on okay. No pain, right?
No.
I'm going to go ahead and take my gloves off the proper way and dispose of them. And perform some hand hygiene. I'm going to take a label, a pen. And since I'm done with my sterile field, it's okay. I'm going to put the date, November 11th. It is 8/27. And I'm going to put my initials. Try not to play with it, okay? Just going to put this on the side of it so we know when to change it next. And I'm going to dispose of everything properly. I throw this all away in the biohazardous bag, lower the patient's bed back down in the lowest position, put the call light in reach for her, and if I put down a side rail, make sure I put the side rail back up. And then just check on her. You feeling okay?
Yep.
Do you need anything else while I'm in here?
No.
Alrighty, thank you.
Uh-huh.